go over some Saunders lumbar traction.
Okay.
Because we've been using the table-based traction for about a month now and you've had some really good results, we now are going to be in symptom management. So we've gotten the Saunders unit ordered. Let's go over a couple of the pieces.
Okay.
Most important thing is the instructions, which is great. Also some troubleshooting if you get home and you're struggling with some of the equipment or how to set it up. What is really nice is it's super easy to store and also roll away.
Okay, cool.
It would roll under your bed, it would roll into a closet. Depending on, you know, is this something you're going to pull out and use because you don't want other people in the household to mess with it, or it may be something you can just leave out.
Okay.
You can do this on the floor, absolutely, or maybe you set it up on the guest bed down the hall where, you know, maybe it's that mattress that's a little more firm, but we definitely need a firm surface. So
Okay.
okay, a couple pieces of it, or additional things we're going to use is, again, we're going to have a call system. So in case you get down on your table and you're struggling or having some discomfort, or you just need someone to come check on you, you have your call system to alert somebody, and then we need a timer going, because odds are this is going to feel pretty darn good. And you may even fall asleep. And last thing we want is for you to be down on your table and getting a stretch for 30 minutes over to an hour.
Okay.
And so just a little kitchen timer or maybe your cell phone, and set that timer for that 10 or 20 minute duration, okay?
Okay.
The table, really, once you unzip the apparatus, the belts are secured to the table, and all you're gonna do is flip them open. The gauge is secured to the table, and I'll teach you to use that in a moment. The only thing you would add is a pillow for your head, and then a pillow under your knees, just to kind of make you a little more comfortable. And kind of looking at the protocol for you would be to be in neutral spine. So a little bit of support under the neck for neutral spine, a little support under the back of your knees in a moment for neutral spine. There is the potential to do this where you just do an absolute straight pull, a zero pull, which would mean you would lay without a pillow under your knees, or just maybe a towel under your head so your neck isn't so flexed.
Okay.
And then the third option for a patient would be to lay prone on their stomach. And when we lay prone on the table, the buckles would need to buckle in the back. That definitely is going to be something that you would need someone at home to help buckle you into. But that's specific for a posterior H&P or herniated disc in that L4, L5 segment. And that's not quite what we're working on with you today. We're going to go with the neutral spine position. And we're going to kind of look at seeing if we can get some relief to that degenerative disc or degenerative disease of the joint, and just that general achiness and tightness you have through that lumbar region.
Great.
Great. Because of the height of the table, we have a little step stool, so I'm going to have you just kind of come sit up onto the table, and I'm going to have you lay down. Your hips or your pelvis is going to kind of lay into this first belting,
Okay.
and then the second belting is really going to look to kind of come around the widest part of your rib cage, ribs 7, 8, 9, and then also kind of at your xiphoid process. I did ask a few minutes ago off camera for you to remove your belt, and then we also did a quick skin check just to make sure that you don't have any tubes, we don't have any wiring, we don't have an insulin pump, we don't have any sort of wound in this vicinity, and that your skin is tolerant to having these belts wrapped around. These belts are going to need to be snug, not tight.
Okay.
All right, let's get you on the table. There we go. Thank you. There we go. And that looks really good. So just kind of slowly lay back. There we go. And I'm going to go ahead and slip this pillow under the bottoms of your knees.
Okay.
And you can just kind of relax down. We may want to take one scoot up. I lied. Let's do one big scoot towards the head. That looks really nice. Okay, perfect. So we're gonna wrap these belts around your waist. And again, one of those questions we had upon evaluation was if you were claustrophobic. Once again, this would be something that is gonna restrain you down to the table and definitely be pretty snug. So if you were claustrophobic, sometimes this is not tolerable. We also asked for you to empty your bladder before we get on the table, just because this is going to be snug through that pelvic area. And once we get going, we would not want to have to stop treatment to get you off the table, because in the clinic we would have to kind of call the session for the day. Okay, so this is going to be snug, but not tight. How's that feel?
Good.
Good. Pillow under the knees, okay?
Yes.
Yeah.
That's great.
And we can also, if your back felt a little better with your knees slightly more flexed, we could use a bigger pillow as well. So we'll kind of see how you like it or tolerate it.
Okay.
We talked about the numbness and tingle you're having down your leg. It's called radiculopathy. We talked about how it is currently peripheralizing all the way down to your big toe, through your hamstring and your calf. The hopes is, as we do these traction sessions, just like on the clinic table, is that it starts to centralize.
Okay.
That would be a really good sign. If your numbness and tingles is getting worse, that would be a reason for us to stop. If you seem to lose bowel and bladder control, that would be a reason for us to stop. Okay. Also, we took your blood pressure before we got on the table. If your blood pressure is showing signs of being hypertensive, this would not be an appropriate treatment for you.
Gotcha.
Okay. All right. We've got our safety items, so we're going to go ahead and have that timer within reach. We're going to go ahead and have that alert system within reach. So I'm just going to put them down by your hip.
Okay.
And then we have a gauge. This gauge has, and I'm going to put this where you can see it because you actually are going to operate it.
Okay.
This gauge dial has some black numbers and some red numbers. We're going to use the black because that is in pounds and the red is in kilograms.
Okay.
The other part is if you pivot this, the head of it, you're going to see where it says pump, you're going to see where it says hold, and you're going to see where it says release. Right now I believe it's on pump. Perfect. Okay, so you're going to hold the gauge, and then it's a little bit of a push and pull on the gauge. Let's go ahead and take you up. I believe when we were in session in the clinic, we were up at 50 pounds.
Okay.
Yeah, so let's go ahead and pump you up to 50 pounds. What you're going to see and feel as you pump is some separation of the table underneath you. The pelvic belt kind of keeps you anchored stationary, but we definitely are getting some pull upwards upon your rib cage, and that's facilitating that gentle stretch of your lumbar spine, or the separation of the pressure upon the disc, or the separation of the vertebral bodies. This is that juncture where if your symptoms were to get worse, we would want to reduce the amount of tension or stop.
Okay.
Sometimes it takes, so you're at your 50 pounds. Awesome. So turn it to hold.
Okay.
And then we're going to go ahead and start the timer. And then once you turn the gauge to hold, you're just going to kind of lay it down. And then again, this is that relaxation. Nice deep breathing, close your eyes, try to relax to the best of your ability. Good. And then we have our call system in case for any reasons you're struggling to get out of the unit or possibly struggling to get back up off the floor, would be some reasons that call system would be helpful. Okay. Okay, so our 10 minutes has elapsed, so I'm going to have you go ahead and turn the gauge to release. Perfect, and you'll just hear the air kind of come down out of the chamber. Once it has released, you're just gonna put the gauge off to the side. And then what I'm gonna have you do is just loosen your belts. So just right there, kind of pull up and release. Yeah, and it's gonna be like, oh, I can breathe.
Yeah.
Perfect. And then there's one more. Perfect. Okay, probably would be good to lay here, maybe get 2 or 3 nice deep breaths in. Because of that amount of pressure put on your torso, sometimes it can affect your blood pressure. And that's why it's important you don't get on the table if you're already hypertensive. Okay? Now, once you've laid here and acclimated to the release of the belts, you're gonna go ahead and pop the buckles. There you go. Nice. Just dying to help you here. But I'm not going home with you. Perfect. And then we'll just kind of open our belts out. Good. And then I'd lay here another minute or 2 to just kind of let you acclimate. Sometimes when we come out of traction too quickly, and so you got to think of for that 10, 12, 20 minutes that we were in nice distraction, we came down pretty quick.
Yeah.
And then we would probably want to lay here a minute just to get those muscles to relax, to avoid the occasion of what's called rebounding pain. Rebounding pain is when we separate and then we come back too quickly, like a rubber band. So if you and I were pulling on a rubber band and one side let go and it just rebounded quickly, you get that snap feeling, right?
Okay.
We want to avoid that. We're gonna roll over and sit up. The next thing we're looking for is trying to log roll. You may want to tighten your tummy a little bit. Come up into a seated position. Get this pillow out of the way. There we go. And we're in no rush. You're gonna sit here for a moment, because what we're looking for is to make sure we're not having any sort of orthostatic hypertension or a really fancy word for low blood pressure. How do you know you're having it? You get lightheaded, dizzy, you may see some spots. It's very normal when we've changed a position and done this type of treatment. If you are lightheaded and dizzy, you just sit here a few minutes and it usually passes. And then you're able to go off on your day. Okay. What I would also tell you is it definitely takes several sessions of traction before we kind of can tell if it's making a difference. Sometimes you're sore because you did just get a really good deep stretch for about 20 minutes of the muscles and the ligaments. And so we're deciphering the difference between, am I just sore from the stretch or am I having pain, numbness, tingles, burning type of nerve sensation? I usually will say, how do I feel right now? How do I feel at dinner time? And how do I feel tomorrow morning? And because your symptoms will probably change as you go through this kind of first 24 hours. So that then that data helps me and you decipher the settings. If we want to keep it just the same, if we did it a little too aggressive, or if maybe we could kick it up a little bit in both poundage and duration of time.
Okay.
All right.
Sounds good.
Last thing is we'll step off here in a moment, go to the changing room, let you get redressed, and then in the process, just do a quick skin check to make sure we didn't have any irritation.
Perfect.
All right, questions?
No, ma'am.
All right.